Hi, I'm Dr. Jack Sava, the Director of Trauma at MedStar Washington Hospital Center. You know, 9/11 was my first day of work. I was officially on the payroll, but I wasn't allowed to touch patients because my medical license hadn't come through. The paperwork hadn't been completed by the medical board. So I was sort of hanging around the hospital trying to be useful, and then September 11th happened, and they immediately granted me emergency privileges, and I was off and running that morning. So that was my first day as a doctor here. I first developed an interest in trauma when I was a surgical resident, and I was learning to operate. And I saw a couple surgeons that were doing operations and kind of got in over their head. And I watched them get a little bit scared, and I vowed I can never be scared like that. After that, I became really drawn to the idea of operating all over the body, which, if you think about it, is not that common in modern surgery. Typically, people are very specialized. A trauma surgeon needs to be able to operate on the heart and the kidney and the intestine, you know, in one night, maybe on the same patient. And that is a challenge that's scary when you're starting out, but it tends to keep you sharp, and it ultimately is very satisfying throughout a career. I believe that doing trauma care gives trauma surgeons a particular opportunity to participate in something that's sacred. And I think to come to work and to do the very best you can for somebody is an opportunity to bring out the best parts of ourselves. And it's something that we may not be able to muster outside of work, but the environment supports it, the culture of MedStar supports it, and that's important to me. I do get a certain feeling when I look up in my backyard and see a MedStar helicopter flying around to save people. We're proud of having a really sophisticated transport network. We need to be able to find patients wherever they are and bring them to where they can get the best care. I have a girl, she sends me flowers every year on the anniversary of her horrible car crash, which was on the way to her prom when she was 16. And there was a lengthy discussion when she was injured about whether or not she was going to be brain dead and whether or not care should be continued. And we ended up doing probably between 15 and 20 operations on her. Anyway, now she's just finishing her MBA, and she is starting a family, and she is fantastically happy. And every year she updates me on her progress through life and thanks the team. It's very gratifying.